Okay, again, so let's continue, no? Next is our, what we call T wave. Again, T wave. T wave. Now, class, our T wave. Hala, napuang na. Okay, ayan. Okay. Our T wave, no? It is responsible for doing what we call our ventricular repolarization. Repolarization. Okay? Repolarization. Now, class, in ventricular repolarization, this is now the relaxation. Okay? Relaxation of the ventricles. Okay? Now, balik ta. Okay? Outside na ta. When we say P wave, class, mamina mo ha, and look at the bottom, kinidilapit. When we say the P wave, no? What happens during the P wave is that there is now what we call the conduction of impulses, diba? Conduction of impulses. So, from our SA node, it will travel to your, as I've said before, atrium and then your AV node. That is what happens during your P wave. Those are the events, no, that occur during your P wave. And then suddenly, class, no? Suddenly, if you follow the wave, tanawa, sundan ninyo, it will go down. Okay? It will go down because as I've said, diba? There is a slight delay. Especially because it now needs to travel. Okay? So now, class, ni travel na siya. Sige, ito balikon, nga skilled. When it travels, okay? Okay, now if you remember, class, when it reaches your Purkinje fibers, it will contract. During the contraction, that is now the sudden rise. Nikalitra siya saka, di ba? There is a sudden rise. Sudden rise. And then, slowly, munaog siya balik. And then, it will normalize. Okay? That is what occurs during your QRS complex. During your QRS complex, the ventricles will now contract. Okay? It will now contract. Once it normalizes, class, no? Diba? Your ventricle is now contracted. Okay? Diba? Contracted. It will need a few moments before the T wave starts. The T wave is now the relaxation of your ventricles. So, imong ventricles, it will now relax. Okay? Mo relax na imong ventricle. And then, the cycle repeats back at the P wave again. Okay? At a rate of, as I've said before, 60 to 100 beats per minute. 60 to 100 beats per minute. Mo na siya, class. Basic ECG. Okay? Basic ECG. Now, sige, para di mo maglibog, class, let us color code it. Okay? The color coding, ha? Okay, so the first part, ang atong P wave, we will color it blue. Okay, during the P wave, class, during the rise of the P wave, that is now the transmission or the movement of impulses or conduction of impulses through the atria and to your AV node. Okay. As there is a slight delay, mo na ni siya atong slight delay. Okay, and then suddenly it will move. Once it moves, class, let's color the QRS complex yellow. Okay, once it moves, okay, back yellow, di man maklaro. Ato lang yung green. Okay, once it moves, okay, ayan, move na siya, no? It moves. Once it reaches your, once again, Purkinje fibers, there is a sudden rise up because ang mahitabo is your heart will now contract. Your ventricles will now contract, di ba? Your ventricles will contract on itself, no? It will contract, di ba? Mo contract wala. Okay. And then it will slightly ease off, no? Once it is fully contracted, and then it will normalize. Okay? And then it will take a few moments before what we call our T wave occurs. Now, during the T wave, class, when the T wave now occurs, it is because the ventricles have now relaxed back at its original resting position. And then the cycle repeats all over again. Okay? the cycle repeats all over again. That's why we call it a cardiovascular cycle or our heart conduction cycle. Okay? Now, na siya, no? ECG basics. Ayan, grabe kay class, no? No? This will occur at a rate of 60 to 100 beats or cycles per minute. Okay, di ba? This is also our normal heart rate. Okay? If it is greater than, greater than 100, we call that class our tachycardia. If it is less than 60, we call that bradycardia or slow heart rate. Ayan. Now class, grabe kitag discussion about basic ECG. We have not even defined an ECG yet. An ECG, also known as your echocardiograph. Okay? Echocardiograph. It is a visual representation of the heart's conduction patterns. Okay? It is a visual representation of the heart's conduction patterns. Okay? Ayan. Next class is our heart sounds. Okay? Ako nag-isuot nila class para mag-copy na mo. The heart sounds are produced by valve closure. Okay? As described above. Okay? The opening of the valve is normally silent. Ang opening, silent, pero ang closure na ay sounds. Okay? Normal heart sounds characterized as our lub-dub or S1 and S2. Okay? And occasionally, class, we can hear extra heart sounds and murmurs, which can be auscultated with a stethoscope over the precordium. Later, we will discuss the precordium, okay? Which is the area of the anterior chest overlying the heart and the great vessels. Ayan. Now, these are the normal heart sounds. First is your S1, also called your lub, diba? When they describe our heart sounds, no, it is lub-dub, lub-dub, lub-dub. Ayan. Okay. This is caused by the closure of the atrioventricular valves. Atrioventricular valves. Okay? The S1 class is best heard at the base. Okay? At the, not base, apex of the heart. This is best heard at the apex of the heart. Now, class, I forgot to mention this. Okay? Ani na siya, balik to sa heart. Okay? When we are talking about the heart, it is not the same as the lungs. Okay? Di ba sa lungs, class? Di ba in the lungs, the base was on the bottom? Okay. For the heart, class, the base is on top. Okay? Mao ni siya ang atong base. Whereas when we say apex, it is this part here. This part is the apex. So when we say apex, it is the bottom part of the heart. Okay? The one that is facing your left lung. Ayan. Okay, so as I've said, no, this is best heard at the apex of the heart. Okay? Now, when we are auscultating breath sounds, it is best to remember, auscultate, no? If it is normal sounds class, auscultate using diaphragm. Ayan, auscultate using your diaphragm. Not the diaphragm inside your body, but the diaphragm of the stethoscope, for the love of God. Okay? The S2 naman class, it is caused by the closure of your semi-lunar valves. Semi-lunar valves. Okay? Ayay. Yan. It is best heard at the base. Okay? Base of the heart. Okay? Base of the heart. Now class, no? I have in the description, no, of this video. In the description of this video, I have provided you with a playlist. Okay? Playlist na nasa YouTube wherein you can hear the sounds of the heart. I have both, currently right now, I have both normal and abnormal heart sounds there. Okay? Ayan. So, mo na siya. Okay? Next is our extra heart sounds. Now, our S3, no, or our ventricular gallop as it's called, it is best heard at the apex. Okay? And when you auscultate this, you have to use the bell part of stethoscope, because this is a what we call this abnormal sound, no? Usually it is a very low pitch sound. Ayan. Now class, your S3 class, no? It occurs, okay, pamina mo, it occurs in early diastole. Okay? So it occurs in early diastole. Okay? And it sounds like this. Okay? It sounds like lub, dub, dub. Ayan. Lub, dub, dub. Lub, dub, dub. Lub, dub, dub. Ana. It sounds like that. Lub, dub, dub. Lub, dub, dub. Lub, dub, dub. Ana. Okay. Next is your S4 or atrial gallop. It is also best heard at the apex. And we also use the bell part, okay, of the stethoscope. Okay, but this is heard, class, usually in late diastole or diastole. This is characterized as dub, dub, lub, dub, 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 lub, dub, 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 lub, dub, dub, lub. Okay, nga na. It sounds like that, no? As I've said, no, there are videos in my playlist. In the playlist, I have linked in the description below. That will send you links, no, to videos that I have personally chosen as a good example. Ayan. You know, sometimes, no, both of these can show up at the same time. Okay? Sometimes both of these can show up at the same time. As you will see in the video, no, it sounds like lub, lub, dub, dub. Okay? Ayan. Muna siya, no? So, muna siya. Next is our murmurs, no? Murmurs, class, we already mentioned this, no? Blood normally flows silently through the heart. However, there are conditions that can create turbulent blood flow. If you remember, turbulence, no? Creates a swooshing or blowing sound. Mo na ni siya, class, ang atong murmurs. Now, I will not get too specific into murmurs, class, because there's actually a lot, okay, mabina muna ko, a lot of what we call this types of murmur, but they will be described in your what we call this, our maternal and child nursing pag second year ninyo. Okay? Ayan. Okay, now class, when we say turbulent blood flow, class, there are a few causes to turbulent blood flow. The first among which is what we call increased blood velocity. Paspas ang dagan sa imong blood. Number 2 is structural valve. Ayay, baga kayo. Structural valve defects. Ayan. Number 3 is what we call our valve malfunction. Number 4 and lastly is our abnormal chamber openings. Ayan, abnormal chamber openings. Now, if you remember, class, no, I am mentioning this right now because these not this one. Okay, kini silang last 3. These are common problems in newborns. Common siya ng mga problems in newborns. That's why this will be discussed, no, in greater detail in your MCN or maternal and child nursing. Ayan, ready na mo, class. Abot na sa mo, class, ni Ma'am Jaime. Ayan, let's go. Next is our cardiac output. It is the amount of blood pumped by the ventricles per minute. The amount of blood pumped by the ventricles per minute. Now, this is the formula. Cardiac output is equals to stroke volume times, okay, multiplied by the heart rate. Okay? Let's say, for example, class, no? Let us define first. The stroke volume is the amount of blood pumped with each contraction. So every time mo contract ang imong heart, it is the amount of blood that is being pumped. Normally, it is around 50 to 100 ml. Now, class, when we say heart rate, it is the number of contractions per minute. Diba? We already know this. It is 60 to 100 beats per minute. Let's say, for example, the SV is, let's say, 70. And then the heart rate is 70. Okay, now let us solve, no? 70 times 70. Ang answer, anak class, is if I 70 times 70 is 4,900. Okay? When we say 4,900, that is now our cardiac output, meaning that is 4,900 ml per minute. Okay? ml per minute. Meaning, every minute, the ventricles will pump out 4,900 ml of blood. Okay? So, grabe ka na gano'n. 5 liters, almost 5 liters. Diba? Almost 5 liters mo na siya cardiac output. Ayan. Next is auscultation skills. Now, here's the things you have to remember, class. The client should be supine with the upper trunk elevated 30 degrees. So, for example, if the client is supine, naghigda siya, okay? Naghigda ang imong client. Your client is now supine on bed. When we say elevated ang ilang upper trunk 30 degrees, what we mean by that is they look like this. Ayan. Okay? They look like that. Elevated ang ilang upper trunk. Mo siya ang bed, no? We can use that with a hospital bed because the hospital bed, if you know, it is adjustable. Diba? We have to use the diaphragm to auscultate for high-pitched normal sounds and the bell to auscultate for gallops and murmurs. Kato itong mga abnormal sounds. Diba? And then we have to apply the stethoscope firmly to the chest. Okay? To the chest. Now, class, the important part here is not that. The important part here is this. Okay? Now, class, these are the 5 traditional areas of auscultation. 5 traditional areas of auscultation. Now, 5 traditional. It is very good, no? If it is very good, no? If you try to remember, if you try to just remember. Okay? If imo lang hinumduman, as a dapit, it is good. But sometimes, no, naman yung mga physicians nga, they want you to describe in words the location. So, let us begin one by one. Now, class, let's start with the aortic area. Now, class, remember, class, your body is divided into half. Okay? In the mid-sternal line. Okay? This one here is the right, and this one here is the left. Okay? So, let us start with the aortic area. Ato say, istorya one by one. Your aortic area, class, is found in your, this is the first, and this is the second. Second, intercostal space. On the right side, at the sternal border. When we say sternal border, class, we will refer to it as our SB. Okay, sternal border. When we get external border, class, when we say sternal border, it is beside your sternum. Kita mo, it is beside your sternum. So, when we say, okay, sternal border, SB. Okay. Ato butang ata. Right sternal border. Kanaon. So, when a physician asks you, okay, Dong, Day, tell me where the aortic area is. Okay? So, muna ito sa istorya ganyan, class na kato atong gitawag nga precordium. Diba? Mga areas of auscultation. The aortic area is directly above your aorta. Okay? So, mga tanan doktor nimo. Dong, Day, describe to me the aortic area. So, ang imong tubag is, Doc, it is found at the right sternal border in your second intercostal space. Diba? Right sternal border at the second intercostal space. Okay, ato balihon. Let us go to your pulmonic area. Your pulmonic area is in your second intercostal space in the left sternal border. Diba? Second intercostal space at the left sternal border. Diba? First, second. Ayan. Next is your Erb's point, no? Diba, kini siya, class, pulmonic area. This is above your pulmonary artery. Diba? Pulmonary artery. No? Next is your Erb's point, no? Your urge point class, it can be classified as your third, di ba? Third intercostal space at the left sternal border. Left sternal border. Okay. Tubutang niya. Fourth, fifth. Ay. Fifth. Ayan. Next is your tricuspid area, which is directly over your tricuspid valve, no? Your tricuspid area, if you count 1, 2, 3, 4, 5, it is at the fifth. Ay. Wrong spelling is wrong. Fifth intercostal space at the left sternal border. Diba? Sa yun, no? Inganaw na siya pag-describe. And lastly, class, is your mitral and apical area or apical area. The mitral or apical area is otherwise known as your apex. Ayan, apex. Okay, or apex, no? Diyan na to makita to apex. This is the site of what we call our apical pulse. Okay? Apical pulse. The apical pulse is significant because it is one of the most accurate areas when it comes to assessing heart rate. Di ba? Kaya mo magina sa apex mo gina, the area of contraction. No? So, to describe your apical area, you have to remember it is still in the fifth intercostal space. But now, wala naman siya sa sternal border, di ba? It is no longer in the sternal border. So, it is still on the left, at the left. Unsa man ang iyang kuan? What is its kuan? Landmark. It is the mid-clavicular line, di ba? Middle of the clavicle, no? So, it is the fifth intercostal space at the left mid-clavicular line. Mid-clavicular line. Ayan. At the fifth intercostal space in the left mid-clavicular line. Di ba? No? So, muna siya. No, that is how you describe your, what we call, precordium areas. Ayan. Next is our arteries. Ayan, arteries. Now, class, no, our arteries, class, it's very simple actually. Our arteries are responsible for carrying oxygenated, nutrient-rich blood. Okay? Aside from that, class, it also each heartbeat forces blood through atrial vessels, creating what we call an arterial pulse. Okay? Remember this, only an artery can have a pulse. Okay? That is because a heartbeat forces blood through the vessels. Okay? Ma-push. Okay? It pressurizes the artery. In turn, class, because the heartbeat forces blood, okay, this in turn makes our artery very thick. Okay, it has thick and strong walls. Okay, thick and strong walls. Okay, it is to resist the pressure para dili siya mubuto, so that it will not di siya mubuto, no? Next is, aside from that, it also has a smaller diameter. Okay? So, kita ni mo kaso, baga kaayo, it is very thick. Its walls are very thick. However, its diameter is very small. Muna siya ang atong artery. Okay? Now, class, remember this, class. Remember this. For the love of God, do not forget, only an artery has a pulse. Okay? Because it is pressurized by our contractions. No? So, these are the major arteries of the periphery. Okay? First is our arms, no? Sa atong arms, class, no? Sa atong arms, we have our brachial artery, our ulnar artery, and radial artery. Now, class, the brachial, class, no? Artery, it has what we call our brachial pulsite. Okay? This is the common site, okay? Common site for blood pressure readings. Okay? Common site for blood pressure readings. Okay? We also have our radial pulse site, class. The radial pulse site is the common site for heart rate readings. Diba? Kanabitong nasa tong kamot. Okay? Remember, the radial is at the thumb side. Thumb side. We also have our ulnar pulse, which is at the other side, atong pinky side, in our pinky side. This one class has a weaker pulse, meaning it is not very viable, no? When you try to palpate it, it is actually sometimes very difficult to palpate it. Lisod, okay, because it is a very weak pulse compared to your radial, no? Compared to your radial. Okay. Next is our femoral. Okay. So we have our three arteries here, the femoral, popliteal, and our tibial, both anterior and posterior. Now, I have two sites, pulse sites in mind. First is our femoral pulse site, kini siya dapit, okay? Which is found at around our inguinal area. No, if you try to palpate it na ay pulso diha, no? Okay. Next is our popliteal pulse site nga dapit. It is at the back of the knees, no? Sa posterior side of your knees. It is an alternate BP site. Alternate BP site. For example, your patient does not have arms, okay? Or maybe naa sila what we call this limot ko kana sa dialysis, no? Kana sa dialysis, the thing they used for dialysis, no? If naa sila nga na, there is a tendency that you may need to use your popliteal site for blood pressure monitoring. Okay? We also have our anterior and posterior tibia artery, which carries blood all the way down to your lower leg. Okay? Ayan. The pulse sites in the lower leg, no? They are still significant, no? The posterior tibial pulse site is quite strong, and it is actually a good comparison point when it comes to heart rate, no? We can compare it, we can use it, no? If they do not have arms, we can use it to get a heart rate. Kaya mura man siya brachial artery, kumbaga, no? Radial artery, kumbaga, no? But our dorsalis pedis is similar to our ulnar, wherein it is very weak. It is very weak. Ayan. So next is pulse strength class. Okay, now it is very self-explanatory. You can pause the video, no? You can copy it. Very self-explanatory. I just want to highlight one thing. Okay, the only thing that is normal here is number 3. Maura gid na siya normal. Okay, mo gani normal pulse. I want to highlight absent pulse. Okay, if the pulse is absent, the next thing you do is to check the apical pulse. Okay, check the apical pulse to confirm nga naapay heartbeat. Okay, it is to confirm that there's still a heartbeat. After that, you check what we call our carotid artery. Carotid artery pulse. Okay, the reason why we check our carotid artery pulse is to check if blood is still flowing towards our brain. Diba? If blood is still flowing towards our brain. Ayan. So, mga nasa, no, it is very self-explanatory. You can pause the video and copy. Okay? Pause the video and copy the following information. Ayan. Okay. Next is our veins. Okay, our veins. Okay, this is slide. What slide is this? Slide 15. Hapit na. Hapit na tayo mamatay. Ayan. Almost at the end. No? So, our veins class, no? They carry unoxygenated, nutrient-depleted blood. Okay? It has much lower pressure compared to the arteries. Now, remember, ang atong arteries class, ha? Our arteries, remember, ha? All the shit. Remember ha, our arteries class, they have high pressure because of the contractions, di ba? Because of contractions. Di ba mo contract ang imong heart and thus pushing blood through your arteries. Ato sa ikuan save kay para makakuanta. Pas. Ayan. Shit. Okay, because of contractions. Now, class, when it comes to veins, class, no, there are no contractions to speak of. Diba? There are no contractions to speak of. Now, because there are no contractions, class, it does not need to, what we call, withstand the pressure. That is the reason why, class, veins typically have thinner walls. Okay? Thinner walls. Okay, tanawo, nipis ra kayo ang iyong walls. Okay? But the diameter is larger, or diameter is larger. Ayan. The diameter is larger compared to arteries. And as I've said, no, it is a low pressure system. Low pressure. Okay? Compared to your artery which has high pressure. That's why taas kay pressure makahimo siya pulse. Okay? Pulse. Now, class, here's the thing you have to remember. Okay? The diameter is larger because it has to accommodate what we call our valve. Okay? Our valve. Now, ingani man guna siya, class. If you remember, the valve, it will ensure one-way flow and it will prevent backflow. Now, ingani man guna siya, class. Tanaw ha. Let's say, for example, mag-drawing ta. And listen well. Bahala nagkatugo na ka. Ayan. Ayan. Ayaw ni. Kining harita mag-drawing. Ayay ka. Let's say for example, class, this is a leg. Saan siya? Leg, tiil. Okay? And then the red drawing is our artery. The green drawing is our veins. Okay? And then when we zoom in our veins, class, it looks like this. Okay, ato nag-zoom in atong veins, nga na siya now. Okay, nga na. Ayan, nga na siya valves, no? Na siya valves, ana. Now, ingani na siya, class, no? Awa, notice the blue, bantay ang blue. Okay? An artery, ang atong artery, class, no? Atong artery, it will have no problem sending the blood down. Because as I've said, it is highly pressurized. Because every time the heart contracts, it pushes the blood moving or it keeps the blood moving. So walay problema ang pag-naog. Okay? When we are sending blood down to our feet. Okay? Now, class, here's what I want you to remember, ha? Atong veins, they will always drain back to our vena cavas. Vena cava. Okay? Atong vein, they will drain back up to our vena cava. So, it will return to the heart using our vena cava. Specifically for leg, no, it is the inferior vena cava. Now, the problem there, class, is we have what we call our best friend, no? Gravity. Okay? Gravity. Now, gravity, no, it pushes everything down. Diba? Here is the problem. When blood tries to rise up, class, when blood tries to rise up, maglisod siya saka, it will have a difficulty rising up. The main reason why is because of gravity. Diba? Because, class, there is gravity, and because it is, if you remember the veins, a low pressure system, the blood cannot easily go up. Okay? It cannot easily go up. Maglisod siya og saka. Now, class, because of that, class, when we zoom in, class, no? When, let's say, for example, you work as a nurse and you keep standing for 8 hours a day, no? Dugay kay tag-as kay mga oras, diba? Sige ra kag tindog. There is a tendency, no, that blood or venous blood or kanang blood in your veins might not be able to climb up back to the heart. Dili makasaka sa heart. Dili makasaka sa heart. So, ang ending, anak, class, is the blood will stay here in the lower part. Okay? Ang dugo, mabilin ra dire. It will stay here in the lower part. Pasabot mo, sir, mabilin na siya, sir. Yes. Class, we call this phenomenon, class, our venous stasis. Otherwise known as our venous pooling. Okay? The blood keeps or is just pooling in our what we call veins, no? Our lower veins. Mabilin ra siya di man siya kasaka, di ba? It cannot go up because of gravity and also because it is a low pressure system. Okay. Now, daghang gigdugo diha, class. Now, if you remember, class, there are two possible problems that are common when it comes to this. If you remember, class, blood has a tendency to clot. Okay? Blood has a tendency to clot. So, let's say, for example, class, there is a clot here. Okay? There is a clot here na i-clot dere. Now, class, that clot is now currently stuck. Nasangit siya because there are valves, di ba? It is stuck. Nasangit siya dere. Class, if the blood that is stasis is clotted, has clotted, and it forms a circle, no? If it clots, if it obstructs, no? Ang tendency na is if nagani blood cut diha, the blood will have more difficulty going up because it needs to divert against the blood clot, di ba? So, class, when a blood clot is non-moving, we call that a thrombus. Okay? Now, this is a common problem caused, this is the common pathophysiology of what we call our deep vein thrombosis. Okay? Thrombosis. Deep vein thrombosis. Okay, sakit ka na, class, very painful, no? Sakit ka na because you are impeding blood flow going up to your heart. Naglisod og agi ang dugo because there is a blood clot or a thrombus. Now, the class, that is not even the main problem. The tendency mong good for blood clot, class, there is a tendency mong good for blood clots, okay? There is a tendency for blood clots to dislodge. When we say dislodge, class, it means matangtang. Okay? There is a tendency for blood clots to dislodge. Okay? Like, for example, kini siya na dislodge. Now, class, if it dislodges, it will move up. Musaka na siya. Okay? It will move up. Or it will go towards your grip. Asa siya padong. And since it has valves, it cannot go back. Di siya kabalik. Okay? Since it has valves. So, when it moves up, it goes up. Now, class, if the clot is a moving clot, we call that an embolus. Now, the problem is if the embolus is in your lower leg because it will climb back to your vena cava, your inferior vena cava. Now, may tabuan na, class, is something like this. Okay? Ayan, sa itong picture sa heart. Kini. Ayan. Let's say, for example, class, the clot has now reached your inferior vena cava. Kini, nasa diri. Ayan, ato siya Ganiyo na to sa kini. Kana. Isa to. Ay, mao. Hala, di mo gana. Hindi mo gana. Okay? Let's say, for example, class, the clot is now in your vena cava. Okay? Nanadire. Inferior vena cava. Since the vessels here are quite large, it will be able to move inside your atrium and ventricle really well. And eventually, it will find itself moving towards your pulmonary artery, towards the lungs. Now, may tabuan na, class, is your pulmonary artery, manggod. As it moves on, it becomes smaller in diameter. Magtaligamay na siya, magtalinipis na siya until it reaches the lungs. Okay? So, ang tendency is if the clot, let's say, for example, moves, okay, nagsigdaga ng imong clot, okay, keeps on moving. Eventually, it will find itself lodged, okay? Lodged against the small diameter of your pulmonary artery. Now, class, that is now a major problem. Okay? Because blood can no longer enter the lungs. Diba? Ang blood maglisod nagsulod sa lungs. Now, class, we call this condition, class, our pulmonary Pulmonary embolism. Pulmonary embolism. Kana. Do you understand? Ayan. So that is just the main problem. No, that is one of the problems. Now, the other problem that is very common, okay, something like this, di ba? Muna na siya itong istorya, atong embolus and our thrombus, our deep vein thrombosis and our pulmonary embolism. Now, kini mo yung other problem. Very common, mas common actually siya. Okay, mas common ni siya ang sunod. Okay. Now, same gyapon class. There is venous stasis. Ngari, zoom in na sa ni siya, zoom in. Ayan, there is venous stasis. So, blood is just here. Nara diri ang blood. Okay? Ayan. Nara diri ang blood. Okay? If nara diri ang blood class, there is a tendency that the vessels will enlarge. Okay? As we've said, no, it is just a very thin and frail vessel. Enlarged ako pag sa diameter. Because of that enlargement class, the vessel might harden. Manggahi ang imong vessel. Manggahi ang imong vessel because of the enlargement. In turn, when it enlarges, it will also be very painful. Di ba? Painful. So, ang ending ana class is what we call our varicose veins. Okay? Varicose veins. Now, class, nakota na ka na ko, sir? Sige, sir. Sige tag storya, sir. We have been talking on how. Oh, okay? We have been talking on how difficult it is to move blood up. Okay? Naglisod mo pasaka. Class, there are two factors when it comes to moving blood up a vein. First is this one. Okay? The first factor when it comes to moving up our kuan is our one-way valve. Okay? One-way valve. The next factor is our what we call contractions of neighboring muscles. Okay, contractions of neighboring muscles. What we mean by that is this. Tanaw ha. If this is your vein, kana green. Okay, ana siya no. And this is a muscle kining blue. Duha na siya ka muscle. Let's say for example imong leg muscles. Now class, when your leg muscles contracts, it will contract, di ba? Mo contract siya. Because of that contraction class, because of that contraction, it will squeeze, okay? Iyahag is squeeze. It will squeeze the blood vessel. It will squeeze the vein. Ang tendency yan is if it squeezes the vein, no? Since there is a one-way valve, since na may mga one-way valve, instead of going down, blood will now go up. Okay? Blood will now go up. That is the reason why, class, no? One of the main methods to avoid varicose veins is to keep moving. Keep moving. Dili ka, you're not just gonna stand in place for long periods of time. You have to keep moving, keep walking. Di ba? Walking. Kay every time you walk, it's gonna keep pushing the blood up. It's gonna keep pushing the blood up. Aside from that, class, no? Another thing you also need to do when it comes to this is after, let's say for example, nurse ka. Okay, you are a nurse. Okay, dugay kay tag 8 hours nagtindog. When you reach home, class, make sure to, for example, raise your feet at least 30 minutes. Okay, raise your feet above or raise your legs above the level of your heart for at least 10 to 15 minutes. So that your veins or your venous blood can return back to your heart. Isaka ang imong tiil for around 10 to 15 minutes so that your venous blood can go back to your heart. Okay? Ayan. So these are the major veins of the lower peripheries. Our femoral vein, our great saphenous vein, and our popliteal vein. As I've said, no, ang atong mga veins, they do not produce a pulse because it is a low pressure area. Because they do not produce a pulse, there are no palpable pulse sites. Okay? I would just want to highlight, no, ang kining mga major. Itong popliteal, femoral, and our great saphenous. However, class, ang good part about the vein is because it is not pressurized. Since it is not pressurized, this is a good site for what we call IV insertion or intravenous insertion. Di ba? IV insertion. Next is our capillaries. Now, class, our capillaries, class, it is the meeting point between our arteries and veins. Okay, it is the site where our artery meets our veins. Kini siya, class, this is the capillary. Okay, as the artery becomes smaller and smaller, it will form what we call our arterioles. Okay, as the vein becomes smaller and smaller as well, it will form our venules. Okay, venules. Now, class, the capillaries are special. The capillaries are special because this is the site where internal respiration occurs. Internal respiration occurs. Okay, now let's say, for instance, class, kining green, this is tissue. Okay, let's say, for example, muscle tissue. Now, if you remember our internal respiration, class, oxygen from the arteries, kini, oxygen, will exit the arteries and enter your tissues. Okay? And now, the tissues, because of metabolism, will create a byproduct called carbon dioxide. And that carbon dioxide will enter your capillaries and your, what we call this, venules. Okay, it will enter your venules to be excreted as a waste during breathing, no? So ang imong oxygen, it will enter the tissues, whereas your carbon dioxide will exit the tissues and enter the capillaries. Mo na siya ang internal respiration. Okay, internal respiration. Now, the force that is governing this movement is what we call our hydrostatic pressure. Okay? Yes. If you want to learn more about hydrostatic pressure, I have a video. I will link it possibly down below. But if I forget, no, tell me to link it down below. It is a video of mine from the previous semester on fluids and electrolytes. Narito ang atong discussion on hydrostatic